In order to properly assess risks associated with any healthcare business, and this goes for hospitals and facility purchases, as well as physician practice roll-ups, which are really popular right now, urgent care centers, other healthcare delivery systems and structures. The employees are a key part of your inventory and your product, the professionals that you're working with. And so the laws and rules governing how those employment relationships work, whether they've been put together appropriately in the first place, whether they need to be changed going forward, and whether additional safeguards need to be put in place to protect the interests of any purchaser is a key part of evaluating the risks and values associated with any transaction.
With healthcare businesses, one of the first things to consider is whether the physicians or other key providers are subject to non-competes or non-solicitation agreements. Sometimes maintaining the involvement of those individuals in the business after the transaction goes through can be central to the value of the company. Other considerations that are very important are wage and hour concerns. Are workers properly classified as employees versus independent contractors? Are they properly classified as exempt or non-exempt for overtime purposes?
It's also important to determine, based on the structure of the transaction, how to deal with any employee benefit plans and commitments to employees under those plans. It's also important to identify how many employees will be retained and transferred to the new entity, and determining whether federal or state plant closing advance notification laws apply, and how to manage compliance with those laws, and if so, which party to the transaction is responsible for managing that issue.
As is the case in many companies, but especially for healthcare companies, professionals with employment agreements carry an outsized amount of weight with the organization. They can influence patient patterns and therefore enterprise revenue. They can also influence how regulators view an enterprise. They can discuss trade secrets or insider information that should be kept confidential.
Some of the largest issues that can arise for a healthcare company, if these issues do not get addressed before the closing, could include things like class action litigation, especially in the wage and hour space, government investigations, including Department of Labor, IRS, or other agencies, state agencies, for example, and potential claims by employees in the whistleblower space that can be very damaging to a company's brand and also financially devastating.
And these lawsuits can cause reputational damage and can disrupt key enterprise tasks such as recruiting and retention. It's also important to address union bargaining issues, as union unfair labor practice charges can be filed or labor actions can arise such as strikes and picketing. Class action lawsuits or governmental enforcement actions seeking substantial back pay or benefits can also arise for failing to comply with plant closing or advance notification laws.
Before closing on any healthcare transaction, it's a best practice to have in place employment agreements, especially with key personnel, that are satisfactory both to those personnel on a go-forward basis and to potential investors, in that they offer protections for the period during the employment of key personnel and following it in non-solicitation, non-competition, and non-disparagement clauses. Key personnel drive the bottom line for a lot of business structures, including physician practice management and other roll-up type structures. So ensuring that their employment agreements are appropriate and ironclad going into closing gives the enterprise the best chance of success.
At a 30,000-foot level, industries look largely the same in terms of the legal issues they face in the labor and employment context, but the details matter. When we look at the specific workplaces and work arrangements that arise in a given industry, the factual contexts are often very, very different from industry to industry. The way that the issues present themselves and the things to look for in healthcare, among other industries, can be unique to those workplaces.